Assalamualaikum warahmatullahi wabarakatuh, and a very good day to everyone. My name is Anissa Binti Jamail, and today I want to present my case study, and my name of case study is the intervention for underweight children. And for your information, I've been placed in Clinic 7 Pandapura for 9 weeks under the supervision of PSC Nurul Aida binti Umbo. Okay, so my introduction. Okay, as for undernutrition occurs when a child had more weight gain than the expected weight according to their age and sex. Okay, and actually there are many risk factors of undernutrition. For example, it could be due to parents' education level, parents' economic status, and the child's feeding practice habits. And actually, parents' education level can influence child's nutritional status because they don't know the consequences of underweight children. And poor socioeconomic status can actually cause poor access to safe and nutritious food supply, since they could not afford to buy quality food ingredients for all family members. Okay, actually there are many factors why child can be underweight. For example, it can be due to inadequate intake of protein and carbohydrates, inadequate parents monitoring during meal times, and they did not eat frequently, such as 5 to 6 times per day, and they're always being sick. So when they are sick, such as when they're having fever, when they are having cold and flu, they reduce the appetite. Yeah? So when the appetite reduces, they don't have the desire to eat, so they will lose their weight. Okay, and then this is based on the socioeconomic information. For your information, this child actually comes from low-income family with family income of 1,500 per month. So actually, they family fall under the category of mudah miskin. So the income per capita is only 187 ringgit per month, and they stay at Rumah Mansur Rakyat currently, and he is living together with 6 siblings. Yeah, and they also receive help under PKZM. So they get food baskets every month. And this is based on Pendapatan Garis Kemiskinan Terengganu 2016, and this is for luar bandar only. So as we see, his house income actually less than 2,000, right? So he falls under the mudah miskin category. And this is the patient history. So we call him Mr. A. He is 1 year and 2 months. So he stays at Kuala Lumpur, Terengganu. His mother is a stay-home mom. She's not working, and he has normal birth weight with 2.75 kg. And his mom was 42 years old when she gave birth to him, and he actually started to be diagnosed with underweight at 6 months. So just after he started to eat complementary feedings, so he started to be diagnosed with underweight. Okay, this is the nutritional assessments. So we start with the anthropometry assessments. So his weight for his current age is 7.5 kilograms, so he is diagnosed as underweight. And his height for age is 73 cm, so right now he is considered normal, so he's not stunted. But his BMI is slightly wasting. So the ideal weight range for 1 year and 2 months old child is between 8.2 kg to 12.6 kg. And this is based on WHO Child Growth Standard 2006. So based on the other weight range, she is quite far from the recommended weight range. As for the biochemical data, it's not available, and his clinical history is only his birth weight. So his birth weight is normal at 2.75 kg, and he started to be underweight from 6 months old. Okay, and then this is for the dietary assessments. As you can see, he currently eat breakfast, and then brunch, and then lunch, and then high tea for snacking, and then he had dinner, and then he did not take any supper. So based on his 24-hour diet recall, so I can estimate the calorie that he take per day is only around 696 kilocal, so slightly less than recommended. So the patient consumed less portion of carbohydrates, protein, and fats in his daily meal, and he did not take enough fiber from fruits and vegetables, and he did not eat variety of nutrients from his food, and then he did not consume the milk given through the food basket. Okay, so the nutritional diagnosis is he is underweight or inadequate energy intake is related to not enough consumption of macronutrient as evidenced by body weight of 7.5 kg, and this is based on Child Growth Standard 2006 by WHO. So for the nutritional intervention, the main objective is to improve his nutritional status to normal weight, height and BMI for his age. So these are the principles. So the first one, we need to increase his body weight at least 100 grams per week by increasing energy intake, and this is based on the formula, which can be done by eating high calorie food. So next, we need to increase his consumption of macronutrients such as carbohydrates, protein and fats, and he needs to eat variety according to suggestion of food permit. And then he needs to increase intake of fiber by eating 3 servings of vegetables and 2 servings of fruits. And then he needs to double the calorie amount by increasing consumption of oily and fried food, and this can be done by adding margarine to white bread. And then the last one, we need to give frequent meals to children with 3 main meals such as breakfast, lunch, dinner, plus 3 snacks in a day. And he needs to follow the scheduled meal times. So these are the examples of high calorie menu for those who are aged 1 to 3 years old, for those who are underweight. And for the breakfast, he needs to take 1 glass of milk with 1 glass of white bread together with 2 teaspoons of margarine. And then for the morning tea, he needs to take half slice of papaya with 2 slices of biscuits and together with 1 glass of milk. And then for the lunch, he needs to take 1 cup of fried noodles together with 2 whole chicken and 1 cup of vegetables, any kind of vegetables will do, and then 1 cup of plain water. And last one, he needs to take desserts such as half slice of papaya. And then little tips, we need to add about 1 or 1.5 teaspoon of oil into the fried noodles. This can be done to increase the calorie. And then for the high tea, he can try to eat 3 whole pisang goreng together with half glass of fruit juice, any fruit juice. And then for the dinner, he can take 1 cup of white rice together with 1 whole fish, and then 1 cup of vegetables, 1 glass of plain water, and half size of whole banana. And also a little tip is we need to mix together with 1.5 teaspoon of margarine together with the white rice. And then for the supper, just a glass of milk. Okay, so these are the example of the menu, and actually this menu I take it from the books which is recommended, which is published by the KKM. So this is the guideline. And for the monitoring and evaluation, we need to make sure that the patient will achieve targeted weight gain by at least 400 grams per month so that he will have a normal weight. And then we need to make sure that the patient eats small and frequent meal, so that he can follow the recommended calorie intake per day. And then we can do the follow-up anthropometry, which can be done bi-monthly so that we can monitor the increment in weight, height and BMI. And then we will do home visit to monitor how they use and how they store the food ingredients given. And then the last one, we need to make sure that the caregiver are compliant to the advice given. As for discussion, actually, a lot of factors that can lead to underweight among orang asli children. Why I'm talking about orang asli, because actually this child is actually orang asli, so that's why I'm talking about orang asli. And factors that lead to underweight among orang asli children are because of poor sanitation and hygiene practice, and then they have poor location to obtain the food, and then poverty, illiteracy, and unavailability of foods. So since they are staying in rural areas, so they are lacking the access to safe and enough food daily. And studies also found out that low household income plays a role in predicting the underweight children. And this is the general suggestion. Parents should actually focus on giving more solid foods to children instead of focusing on giving them high and expensive milk, because eating solid food can actually promote small taste, texture and color development, and it can also increase the fine muscle development since they are using more muscles in the mouth and cheek area compared to when they are eating milk alone. They're only sucking, so they didn't develop any kind of muscle development, only sucking. So as a conclusion, malnutrition can be treated if detected early by double up their serving size. And then parents should also incorporate more solid food into daily meal instead of giving them formula milk only. And then the intervention strategies should also focus on increasing parents' awareness of the negative impact of being malnutrition, so that they can know that what is the consequences of their child's being underweight. Okay, so this is it for my case study. Thank you for listening.